Hello, everybody. I am Jake Tesh, Doctor of Physical Therapy with For Life Therapy, and I want to do a really quick presentation here on keeping your loved ones active. We're doing this in conjunction with Stony Brook Suites, and I hope you guys learn a little bit here from this quick presentation. So our objectives here are basically to describe why it's important for everybody to stay active at any age and to describe the differences between physical therapy and restorative therapy at Stony Brook Suites. So who are we? We're For Life Therapy. We work together with Stony Brook Suites and have been working together since 2012. We provide on-site physical therapy in Watertown, Huron, Sioux Falls, and Brookings, and our staff has specialties in geriatrics, orthopedics, and Parkinson's disease. So what is the role of For Life Therapy and Stony Brook in keeping your loved ones active and healthy? And this slide really kind of shows what our goals are. We want to prevent a decrease in patient's function and maintain a certain level of resilience. And so what is that? It's a characteristic which determines one's ability to resist or recover from a functional decline following health stressors. And so this is a really good graph that kind of shows the demand of an activity, and we call this kind of the demand of activity line. And this green arrow here kind of describes an individual's functional level. And so you can see up in here, they're doing really well, and then maybe they get an illness or they have an injury or pain, and it dips down a little bit. And then they recover really well, but not quite to where they were before. And as they continue to work, they may have another illness or another fall, for example, or something else comes up and they dip down again. Well, over time, what will happen is that individual gets closer and closer to this demand of activity. And once they fall below that level, that's when we start to see patients or residents that are unable to care for themselves or that have a very high risk for falls or medical decline. And our goal at For Life Therapy in Stony Brook is to keep an individual above that red line and allow them to do the things that are required of them throughout their day. So this is a great picture. We're going to say all three of these individuals are 82 years old. And we can see this 82-year-old gentleman who struggles with ups and downs in his green line. He falls below that green line of resilience. And then we see this little lady here who's lifting weights and being very strong. And you can see that there's a much slower decline in her green level or green line until she gets to that demand level. And then we see these gentlemen here running, and we see that they tend to live a very active and long life, and then they decline just a little bit towards the end. So what we're looking for again is to keep that level of decline physically as low as possible. So comparing two possible lines, we see this person in white who is tending to decline a little bit more rapidly, and then they're living their life out in a level of low independence. Where we have this individual who lives a healthier life and is more physically active, basically able to do more functional activities at a given age than the other individual. So again, our goal at Stony Brook Suites and For Life Therapy is to keep all of the individuals, all of the residents above that red line of independence and allowing them to do what they want to be able to do. So what are some things that can contribute to decreased resiliency or falling below that red line? Well, we have the medical illness, we have depression, we have isolation, we have cognitive decline. Physically, we have pain, we have weakness, we have decreased endurance and decreased balance. These are things that we can very easily fix with the programs that we have at Stony Brook Suites. Medically, we're going to work with your physicians to address some of these concerns. The negative consequences of a sedentary behavior. So individuals that have difficulty getting out of their rooms or maybe have some depression that don't want to get out and socialize. We can see all of these changes medically with their cardiovascular system, decrease in body composition, muscle tendon health, all cause mortality, meaning mortality by any cause, whether it be a medical illness or a fall that could result in an event decreased quality of life and decreased bone health. So individuals that maybe have a difficult time and are sedentary can suffer a fairly significant decline. Social isolation, again, if an individual is having difficulties coming out, they are a risk for mortality. And those common contributing factors, again, we have functional limitations, weakness, environmental limitations. Thankfully, at Stony Brook Suites, we do the best we can to accommodate any environmental limitations. Family support. I know each and every one of you cares very much about your loved one, and thankfully, this COVID is starting to decrease so we can actually get in there and visit family members again. But this has been a very big concern over the last year when family just hasn't been able to get in and see their loved ones. And then lack of purpose, and this is depression and individuals who just become weaker and just feel like they don't have a purpose anymore. And then falls, the biggest thing that we worry about. 75% of falls in a long-term care facility. Statistics estimate 1 in 3 over the age of 65 fall each year, and 10 to 20% of those result in injury, hospitalization, or unfortunately death. So falls are something that we take very seriously and are working very hard to prevent. Falls are ranked at the 18th leading cause of disability-adjusted life years across all ages, outranking dementia and kidney disease. That's a pretty significant concern. And over 70, it is the leading cause of injury-related death. So we need to do something to prevent falls. Different factors that increase that risk. Thankfully, at Stony Brook Suites, extrinsic risk factors are at the most minimum. We keep the facility very, very safe. But it's these intrinsic risk factors, especially balance impairments, muscular weakness, gait abnormalities, fear of falling, fragility, or just, again, being generally unwell. Those are things that we address very frequently with what we do in our Stony Brook program. Can we help with cognition? This research article from the Journal of American Geriatrics: in older people with mild to moderate dementia living in residential care facilities, a 4-month high-intensity functional exercise program appears to slow a decline in ADL independence and improve balance, as long as you have non-Alzheimer's dementia. Alzheimer's disease is a much different animal than general dementia. But what we can see here is that we have the ability to improve these individuals' ability to perform anything they want to be able to do. So how do we maintain resiliency? This great review article basically summarizes a multi-component training intervention 3 times per week for 30 to 45 minutes per session. And that is what we try to follow at Stony Brook Suites. So we do that through a couple of ways. We have aerobic training exercises that we perform with the residents. What's important to see here is the intensity that allows for the best improvements. And an RPE scale of 5 to 6 means that individual's heart rate is elevated, they're short of breath, and they're working moderately hard. We also want them working fairly vigorously. So going on the new step at Stony Brook and just going very short, very easy, not elevating the heart rate, does not constitute aerobic training. So when we work with residents, we do push them to become a little bit more vigorous and to increase the intensity of their workouts, because that's what actually helps build and maintain resiliency. Resistance training. We are very strong advocates of resistance training, lifting weights, doing heavy things. The best intensity, again, to see the greatest results is actually upwards of 60% of their what's called 1 rep max. Meaning if an individual can lift 100 pounds, we need to frequently be training them with weights up to 60 pounds. And that's what we do in physical therapy, is to try and identify those numbers so that we can establish an appropriate exercise program for them. Power training, meaning the production of force rapidly. This is important in balance training and individuals' ability to catch themselves if they do lose their balance. So these exercises are a little less intense. We do them a little less frequently, but we need to do them as quickly as possible. We need to contract the muscle quickly and powerfully in order to allow that person to move more rapidly and potentially prevent themselves from falling. So how does Stony Brook Suites and 4Life Therapy work together? Well, 4Life Therapy provides skilled physical therapy evaluations and treatment for individuals that have fallen below that demand of activity line. So individuals down here that for whatever reason have fallen below that line and have difficulty performing tasks. Stony Brook Suites has a fantastic restorative therapy program that helps to maintain that individual above the demand of activity line. So those are how physical therapy and restorative therapy work well together. Triggers for an individual that to require physical therapy would be falls, medical illnesses, difficulty with daily tasks, cognitive declines, pain, self-isolation, among many other reasons. These are things that Stony Brook Suites helps watch for through their restorative program and their nursing program to help identify residents that may need us to come and see them because it's possible that they have fallen below the demand of activities line. What do we do with a resident after physical therapy discharges them? Once skilled physical therapy is completed, meaning that patient is back above the demands of activity line, they're doing well, they have less pain, we strongly encourage those individuals to continue with the restorative therapy program to allow them to maintain the progress they made and remain resilient. The restorative programs are created by the physical therapist during their therapy episode and then educated to trained Stony Brook staff. 4Life Therapy frequently monitors those programs and the individuals, making recommendations for changes and monitoring for any sort of decline. We get the question, why can't the individual just do the exercises by themselves? It is lower cost. Thankfully at Stony Brook, no transportation is required. It doesn't require any support staff, and it's more flexible for the person. Those are all benefits to doing a home program, but the form may become wrong. If the individual is unmotivated, meaning depressed, or they have self-isolated, they may not be completing the exercises. There's a risk for errors related to forgetting the program, losing the program, but also remember the intensity that's required to see changes, both with resistance training and the aerobic training. Sometimes we need somebody to make sure that we are working hard enough in order to justify the treatment and see gains from it. There's no accountability if you're doing it by yourself, and you're likely not to progress as quickly, or you're likely not able to maintain your level. So we very strongly encourage working with an individual after a physical therapy session versus a home exercise program, because we want the individual to get the best bang for their buck and maintain everything that they work very hard for in their therapy sessions. So in conclusion, our role at 4Life Therapy and Stony Brook Suites is to maintain a level of independence, to allow these individuals to do what they want to do and how they want to do it. The best way to combat a decline in physical ability is with physical activity. And so we will encourage all residents to become as active as possible. Stony Brook Suites and 4Life Therapy work together to keep your loved ones active, and restorative therapy following skilled physical therapy helps maintain the resilience, helps maintain the goals that were achieved during physical therapy, and allows that individual to remain in their home. Thank you all very much for listening to this. I hope you learned a little bit, and if you have any questions, please don't hesitate to contact us. Thank you.